And I think, ladies and gentlemen, we are live now on YouTube. And thank you so much for joining us today in the Holy Grail event. This is a preliminary event for the Health Data Forum Global Hybrid Summit that we are going to host later on this year in the city of Porto in Portugal. It's a real pleasure to be here with my dear guest speakers on this panel today for this preliminary session where you're going to talk about Holy Grail, traceability apps that work. Of course, this event is hosted under the auspices of the Conference on the Future of Europe. So we would like to have as much participation as possible in the session, and then, of course, have these the comments, the outputs of these conversations forward to the European Commission and the European Parliament with some citizen concerns on this important matter, health data and the European Union health space. Okay, so without further ado, I think I'll give the floor to Diogo Martins, whilst some other guest participants and speakers also joining the room. Diogo will do an opening session and in the sense of sending a broad mark of what was accomplished by the European Union presidency that is about to complete here with us. And then we'll have a conversation with our guest panelists that I might also introducing right now, and also to gain we'll do an opening session and in the sense of sending let me just start my presentation here. And Diogo, I think unfortunately I could not make the presentation, your picture here as I would like, as Diogo is replacing Luís Pinheiro, which is unfortunately cannot join, but is part of the SPMS team. I'll broadly have here a presentation. So let me quickly introduce the panel we have here today, and this is obviously an event that is being held in the scope of the Conference of the Future of Europe. This is a really important initiative that the European Union started, and I'm very, very pleased to have here with me such renowned guest speakers for having a contribution on this Conference of the Future of Europe. Because, of course, this is what is now required by the presidency of the European Commission, is that we have a voice on the kind of European Union we want to build. And of course, health data is going to fulfill an important role in the future of our European Union. And definitely COVID-19 has demonstrated that it's possible to have, in face of an emergency, in face of a public health emergency, it's possible to have political cooperation, not just in terms of the vaccination, because it's definitely something that we should all be proud in Europe. As we speak today, everybody's being vaccinated in a very coordinated manner all over Europe. And this was accomplished, of course, by the efforts of our political leadership in the European Commission. We are very, very proud of that. And then, of course, there's the second achievement. We were able to get a digital certificate for COVID-19, something that can benefit millions of Europeans throughout Europe, especially in the summer, as we have to still get this fight on the COVID-19. It's not over yet. But on the other hand, we see that there's an opportunity for when we go into digital health, when we go into mobile health apps, there's a wealth of opportunity, and already some of our guest speakers here have experience that they can share, and we can have a lively debate on these. So what are the real challenges that we are facing in the future of the European Union of Health? Now, unfortunately, Luís Pinheiro cannot join us. I was in a hurry trying to replace by Diogo Martins, part of team. We have here today Andrea Rosa Collard, Ricardo Cruz Correia, Arthur Olesh, and Sergio Pillon. I'm going to briefly highlight some of the key achievements, but Diogo Martins is as a IT background as an engineer, and he's been working and involved in many international European Union projects, and especially he will have a lot to say about how the Portuguese presidency handled the job for these last 6 months. We're eager to listen also on the perspectives of the European Union regarding digital health. Diogo will share a presentation for the start of this session. Dr. Sergio Pillon is a pioneer, I would say, in telehealth and telemedicine. Is attached to a number of organizations, and also is featured in the WHO, has made a video on digital health, and his center is the CIRM, whom is his president, is featured on this video and shows how deep the impacts can be of digital health in our well-being and in our future. Andrea Rosa Collard is I'm very pleased to have her here. She's the Director of Information Technology in the Regional Government of Madeira. Madeira is, as you all know, a place of leisure, a place of tourism. It was awarded, I think, the best touristical island destination in the world last year. And obviously, with great esteem and a pleasure to have Andrea Rosa Collard, the Director of Information Technology in that regional government of Madeira. Arthur Olesh is a famous freelance journalist that is related to the digital health, and has a wealth of content being produced, and also in different societies and medical and scientific societies that he is a member of. And Kaveh Safavi, and I'm not sure he's going to be able to join us in the end because he had a serious problem on his agenda. And finally, Ricardo Cruz Correia is a mixture of what I call an academic, a scientist, and an entrepreneur. He's a serial entrepreneur because he started several startup companies that are now growing and having an impact in the health of citizens in Portugal for the moment, but also in the rest of Europe very soon. He's attached to the Faculty of Medicine, the Medical School of the University of Porto. And it's a great pleasure to have him here, as I consider Ricardo one of the most renowned experts in health data that I personally know. And it's good to have him here with us. Okay, so that's it for the presentations. I think we can have now the opening floor to Diogo Martins to get us going on this session, and then we have the comments by guests, panelists. The first to intervene after Diogo will be Dr. Sergio Pillon, because of the duties, as we see, is in the hospital right now, and is going to make the second intervention. And then we have guest panelists intervening, and then we'll complete we'll close this YouTube transmission now and go to the Ideas Lab session later on. Diogo, the floor is all yours.
Thank you so much, Paulo, for the possibility to participate. Great to have you here. Let me just pop up the screen. So, ladies and gentlemen, good afternoon. It is a great pleasure that I'm here to speak about, let's say, the Portuguese presidency and some of the things and some of the digital topics that are related to COVID-19 and the way that we are paving the way for these digital tools. So, a very important message that I want, let's say, to give you since the beginning, that for us, it was very important that during our presidency, on the side of the digital health, it was the time to deliver, the time to accomplish something that was meaningful for our European citizens and, of course, for our Portuguese citizens as well. So what I'm going to show to you, it is that for us, we had 5 main priorities on the digital, on the health sector as a presidency. Of course, I'm representing here the priority of digital health. So for us, it was very important on how can we promote in digital health, although it was very important, topics such as tackling COVID-19 in all the dimensions, from the legal, governance, and of course from the technical side. How can we reinforce the public health cooperation, and of course to strengthen the EU role for global health? But of course, a very important topic for a while, it was the sustainable, equitable, and the universal access to the medicines and medical devices. So talking about, let's say, my core business here, about digital health. So there are 4 main activities that we have conducted in these 6 months of the presidency. So we have made a technical proof of concept with 4 member states, with Portugal, Ireland, Spain, with the regions, Andalusia and Galicia, and Sweden, really to make the possibility to start making a teleconsultation for planned and unplanned care for a set of use cases. It was very important for us to starting understanding that the issues are not on the technical side in terms of really have the tools or have the possibility to set up the environment for this teleconsultation, but it was more or less about, let's say, some legal, organizational, and some operational rounding opportunities. So we have organized the eHealth Summit.pt, that it is already online, that went live on the 1st and 2nd of June with almost 250 sessions. And they are all online. So if you want, let's say, to know a little bit more about digital health, we can learn a bit more on electronic health records, standards, telehealth. That was one of the core focus, where we have organized 7 sessions, international, and 6 on the national landscaping. Of course, about secondaries of health data and digital literacy and some other topics. In terms of on the political side, it was very important for us to really promote the discussion on this cross-border telehealth, and this was a very important uptake for us in the end, in terms of the presidency. What we have finished, it was at EPSCO level, so in the Council of the Ministries of Health, to have a policy discussion about how can we implement the EU digital transformation in the healthcare sector, and of course, how can we remove some of these barriers in relation to the cross-border activities. So, of course, this is not the end. This is not only about cross-border telehealth. There were some other initiatives that was very important and are basically the foundation on why do we decide cross-border telehealth, and was basically the digital skills that both patients and healthcare professionals need to gain. Of course, data sharing ecosystem, that we are not alone and we no longer work in silos, at least in the perspective that we should have an ecosystem among the different actors and among the different entities and among the different sectors and profiles, to really have this smooth implementation of digital health in the routine daily of lives of the citizens and our professionals. It is very important for us to start investment on health data infrastructures, not only in terms of the infrastructure and the hardware itself, but really about, let's say, the capacity to store a huge amount of data for secondary purposes. And of course, how can we store this data on the standardized and the coded format? And of course, this is very linked to the current strategy of the European Union in terms of the secondaries of health data. So it is very important to start understanding on how can we unleash the full potential of health data for secondary purposes, for research, for policy making, and even for understanding better this case. So what we have identified during our presidency, it is marked in this small diagram that, at least for the cross-border context, but this is very similar to the digital health, that it is still very important for us to continue investment on the health data sharing ecosystems, to really connect the different providers, to understand how can we enhance the reimburse system and the reimbursement schemas that we nowadays are in place for the national healthcare services. But of course, to start understanding how can we have this business value from the comparability between the systems, the providers, and of course the health system itself, in order to really to have this flow of the data that can follow the FAIR principles or the interoperability ones. So now giving a national and an European outlook on this specific case. So in the current vision of the Commission and the European Union Digital Decade, in 2030, there is an aim for us to achieve on the e-health sector, 100% of the citizens have access to the medical records. And I think this is a very important message from the European Union, that it is very important that citizens have the access and the rights to make use of the health data for different purposes. It is very important to really to achieve this, that we have the possibility to identify on the unique way the citizens and the healthcare professionals. And this is one activity that even the Commission wants to address. Now coming up this link to the resilience and recovery plans that most of you are aware that is this big financial instrument that is supporting member states to really to strive for digitalization in all the sectors. On the side of the health sector, it is very important to really to strengthen access and to increase equity in the provision of health services. Not only in terms of the telehealth and telecare, because this is a very important update, but as well in terms of the prevention, in terms of the capacity building, and really to have services that are tailored to our citizens, and of course, to smooth the way that our healthcare professionals work in the electronic health records or with the digital tools. With that said, I'm just giving to you nowadays, let's say, some of the how it looks like this ecosystem at the European level. Of course, it is very important that we have this ecosystem that is future-proof, that can propose an evolution, and of course ensures the interoperability between the different systems. But it is important to connect it with the European one. There are some projects or some initiatives across the EU that are already in place. Like, for example, My Health Data EU, that it is an initiative to exchange between different countries of some health information, the patient summary, that is a small data set for unplanned care regions, or for example, the e-prescription and e-dispensation services. This is already in operation for 7 member states, and in the end of the year, they will be 15. Portugal, it is one of them that nowadays it is that. We have, for example, the European reference networks that it is serves for specific guiding for a second opinion or a high-level expertise in terms for the clinicians for rare diseases. And we are extending these services for medical images, rare diseases, discharge letters, and laboratory results. And this is based on an infrastructure that obeys on interoperability standards, on structure and coded of data. So this is very important for us to start looking on this initiative at the European level as the core activity for us to start understanding on how can we change the people perception on the access, on the awareness, and even on the portability of health data. I think this will be one core information that the Commission will give in terms of what they call it European Health Data Space. So now changing a little bit on the discussion on what it is, what we came up here today. So we know that at least in Portugal, there is a strong penetration in terms of on the mobile social media users, in terms of the Portuguese that owns a smartphone, that it is almost 70% of the population, the total number of users. And now we think about, okay, if there is this, so many people that use digital technologies, why they don't use digital tools? Why they don't use e-health services? I think this is something that we need to start understanding on how can we change this behavior from our fellow citizens, from the public sector and the private, the way that they engage with them. So a question to the group and to the rest of the colleagues is, can we prove efficiency with a coverage of 30 or 40% in terms of the digital technologies in relation to the health sector? I think this is something that we quite have some examples at the EU. And some of them that I will present to you that now it is in all the news around the EU, it is really about the EU Digital COVID certificate. And this was a joint initiative that was starting under our presidency, and it was a huge endeavor from the member states to create certificates to prove the vaccination, to prove the tests, and to prove the recovery when we want to enhance or to facilitate the travels across the EU. And for that, it was possible to have these EU standards that use standard economic data, to have a regulation for that, to ensure the cooperation of the different member states and the different institutions that are working in this dimension, to ensure implementation at the national level that works not only for the issuance of the certificates, but as well for the verification, or for example, of the border controls, and of course to have the privacy by design as a momentum, as an implementation. So to you, what I want to tell you is some of the highlights or challenges that we have with us. So at least I have selected 6 of them that are more on the business side. Of course, we can drill down some of them for hours and hours. But I would say that it is important to understand the dimension or the perspective of digital health literacy and digital literacy of our population. What it is the coverage of these technical solutions in terms of the coverage versus the number of active users. This is something that was important for the mobile contact tracing apps. The passive and the active role of the citizens in relation to the use of health data. If I want, let's say, to have an active role with the system, or if the system will act on my behalf, of course, to ensure the collaboration with the digital health ecosystem or with the national digital health networks, like I like to call it, that to ensure the link between industry, research, academia, and of course the public and the private sector. I think it is important to understand what was the overall response of the pandemic in terms of the digital tools and the systems. We quite have some good examples at the Portugal level, with, for example, with the implementation of TraceCovid, with an upgrade of CNAV Lab, that it is our surveillance and notification system for the pandemic, or for example, the auto report that our fellow citizens can do about the symptoms of COVID. Of course, it is very important that we grab the examples at the level and to use common standards like HL7 and some common terminologies like SNOMED, ICDD, ATCC, and so on, to ensure the interoperability and the use of EU reference models. Last but not least, I think this is one core information that I need to pass. It is about the legal side. It is very important that we use GDPR in a good way, in a way that we protect the citizens and we ensure the legal basis and the constraints in terms of the processing of data, and have the privacy and the cybersecurity by the design when we implement technologies. So to end up my keynote, I would say that there are, of course, some ahead challenges that we're having with the implementation of disrupt technologies and novel technologies, such as robotics, such as virtual reality, or 3D printing for health, or even pocket medical devices. It is important really how this will be implemented at the local level, and really to make them not a pilot projects or a pilot initiatives, but really to understand how can we scale up this in a way that will be benefit for the healthcare professionals, for the entities, for the payers, and of course for the people. So thank you so much for the opportunity, and of course this is an obrigado on my side. And you can always go to eHealth Summit to see our sessions.
Thank you so much, Diogo Martins, and thank you for reminding us of the Health Summit website where the sessions are now there. It was a very interesting event, an international conference, and also a high-level conference in the scope of the EU presidency held by Portugal in this first semester. So there's lots of great content there that we can obviously go there. And thank you for this summary and for highlighting the key aspects here for this session. Now, I think that we have already lots of questions in your minds from your presentations. I already have some. I'm preparing here a digital space so that we can have then a more in-depth debate with all the participants that kindly join us in the Zoom room here today, and I see participants from Sweden and also from the US. George Matthews is here with us, or he was with us. Oh, it is with us, George. It's pretty early now in the US, but we'll have time to have these conversations later on. Now we are still live in YouTube, and I know that Diogo needs to leave earlier before we finish. Let's then have the floor to Sergio Pillon. Sergio, thank you so much for being here with us today, live from directly from a hospital in Italy. It's good to have a medical doctor in this panel, as we have to have a perspective from all the multi-stakeholder participants in the health systems. Of course, doctors have a pivotal role there. Sergio, the floor is now yours.
Thank you very much. 5-minute pill from a doctor, you expect a pill. And yes, how we are working now. Strange for a doctor, but I will show you the IEEE. Maybe it's not well known outside the engineers environment, but the IEEE is the largest organization of engineer, and I am part of the group of standardization standards. And let's show you how we are working. And this is from my experience. I manage the Italian national guideline for telemedicine, and I work also with Chilean government for Chilean national telemedicine guideline. Basically, for doctors and for engineers, the classification, the lexicon is something basic. This is my screen. You see, I am accessed as Sergio Pillon. This is the virtual environment we are using in the IEEE Standard Association Telehealth group, the virtual care lexicon. And using a common language, the doctor, I used to classify the disease, because if you make a classification, it's easier to plan, to organize the treatment and everything. We are working at the telehealth lexicon. We start from the WHO, then we are trying to define, let's show you a picture, how a digital health platform interact with external application. We are working together with the ITU, the International Telecommunication Union, and I think that this is, strange for a doctor, but the classification to explain exactly what we are talking about and to define exactly what. And this is very important. And we are classifying telehealth, telemedicine, because if we want to share a common environment, we have to share common lexicon. Yes, I know in English. Let's explain what my Chilean experience showed me. In Italy, we have televisita. In Spanish is teleconsulta. In Italian, we have teleconsulto, and teleconsulto is not teleconsulta. Is hard to define, but in some European projects, the language is very important. Then the technology. Yes, the green card is the European COVID green card was a good example. We have to share, but basically, it's from my patient. I use Google all over in Europe. I can download application, I have my data, I have everything. I would like to have my data everywhere in Europe. And this is what my patient is asking. But to have your data used in Europe, the data have to be translated in the medical language in the other countries, but not the words, but the organization. And I remember a project was called App SOS. and was the standardization of emergency intervention in Europe. And the EPSOS project was very interesting and was based to build a European strategy for common data. We have, so summarizing, WHO that is trying to help us in this direction. We have the IEEE Standard Association, we have the ITU, and we have to put those organizations working together to define lexicon and strategy, at least to have data for an emergency in the EU. But the future is that the telehealth is cross-border by design. By design, I would like to have a telehealth for the future working like Amazon. I can order in Portugal if I am in Italy. I can order in France if I am in Italy. Telehealth, in my idea in the future, could be something that could be a European telehealth. This is the future. For the present, I hope that we can define at least a lexicon, a common lexicon. Thank you.
Thank you so much, Sergio, for sharing the part of the world where you intervene, and it's definitely something that I'm eager to and ask some questions later on. And I think if we all agree, let's then make a round for the panelists, the rest of the panelists to intervene. And then a little bit of a debate before we start the Idea Lab session. Would that be okay? And Andrea Collard, then the floor will be yours now.
Thank you very much. First of all, thank you for Health Data Forums for having these kind of events, which really talks directly to the people and listens as well all the challenges that we have, because Dr. Sergio Pilon was talking about the doctors and the engineers. Diogo Martins was talking about the technical side. Now you put lawyers in the mixture, so you can imagine how that will go. So it's a lot of complexity because there's human rights involved. There's data, there's privacy of the data that is being available online. There's also the healthcare, which is very important and one of the major concerns of society nowadays with a pandemic. So I can see the difficulties and also very big admiration for the Portuguese presidency during this European Commission, because they achieved something that in 2 months, in 62 days exactly, in getting Commission approval and also parliamentary approval for the digital, for the green certificates. So this was a major achievement under the Portuguese presidency, and I really thank them for that, and think they have done a great job, because one of the main concerns and one of the main challenges, as Diogo mentioned, is the privacy, is the legal side as well. And getting this approved in 62 days, it shows the balance. I'm always talking about legal having to have a balance with what's happening in the world at the moment, and through these applications and through the digital certificates, we're getting a little bit of a union there between what is care, real care, and security, and also human rights and the rights of the people, the rights to the privacy of their data, because what we're dealing with is sensitive data, it's health data. And in the future, as Dr. Sergio was saying, if we're thinking of a brighter future where we can really have the same care independently where we are in the world, because in the world of technology there's no borders, it's unlimited. So we should have also the same level of care that we are used to in our own countries when we travel anywhere, and also being able to protect us and protect others. in relation to this. So speaking on behalf of the government of Madeira in these issues, we've been from day one, we actually been one of the regions in Portugal most, very, very much concerned about this. As Paul Nuno was saying, we an island, a beautiful island. We have lots of tourism in the island from all over Europe, from all over the world, and was a necessity that we saw in getting tested at the airport and having some restrictions at the airport to be able to have some kind of control over this pandemic. And I'm very glad to say that we've been very successful in that area. We have less cases by the day, which is very, very good. We having a lot of we saw the need as well of entering this digital era through applications to have some control as well of the people that arrived and of the people that left, and that was done through an application, so everyone on their mobile. We saw that most of the tourists, they do have, when you travel anywhere, you do have your mobile with you. I mean, this is something that it's second nature almost nowadays. So we are offering ourselves to be one of the pioneers in terms of this health and digital in this new world, which means that we are been part of these pioneer innovative projects that are done in Madeira first, to then being able to go across Europe and maybe across the world. So we have this initiative, which is Madeira Digital Health and Wellbeing, because well-being is also necessary. One of the first ones that we having is the telemedicine, like Dr. Sergio was talking about. Very important to see how hospitals can be and certain specialists in certain areas can be. It doesn't mean that they can be in one country, but they can be supporting, and they can be providing care from everywhere in the world through telemedicine. Another one that we have, which was one of my favorites, is Smart Bear. Smart Bear actually looks after senior citizens. So if you have senior citizens that sometimes, like Diogo Martins was explaining, not everyone is very keen on using digital methods. And especially senior citizens, we find some more issues in that area. So this is something. Smart Bear is something that through digital gadgets, like I call it, all the citizens, they can be anywhere. They can be anywhere in the world and have their doctor with them through digital. So they can access how many steps you're doing, like what your breathing is how's your breathing, what kind of exercises are you doing, your heartbeats. So this is all information data that is being given directly to your doctor, that can monitor and can call you directly if they see something is not right, especially in areas where there's not many people. And people live alone. This is very important. The other one is Smart for Health. So it's another area where we're sharing. It's going to be like the base for health data sharing of EU citizens. So we are trialing that. As you can see, like being a lawyer and being a privacy professional, privacy and cybersecurity is extremely important in this area. It's one of our main challenges. It's very important that from the beginning of the development of these new technologies, it is important to have a view of privacy during the whole development, because this will help us in the future as well. It's very important that people are informed of their rights, are informed what these digital gadgets and these digital technologies are used for. It's important that people know where this data is lodged, and it's important that they do consent, because this is something. It's the first time actually that I see a good union between care and security and freedom as well. Freedom of rights, in this case, freedom of mobility. which is very important in the stage of the world that we are facing and with this pandemic. So all I can say is that we're just in the beginning. We have a lot of ground to go, but I think we're going in the right way to the future. And the more that we discuss and the more that we hear what the people have to say and what the experts have to say, it's very important that this reaches the European Commission and reaches also the Parliament, because this is very important for our future. So thank you.
Thank you so much, Andrea Kodjar, for bringing the perspective from a different perspective to this debate. And I'm sure that later on in the session lab, we will have time to go deeper on these issues you have raised. Without further ado, Arthur, the floor is now yours, as I'm hoping that you are also going to bring a fresh perspective to this conversation.
Thank you very much, Paul. First of all, congratulations for Portugal for leading the presidency in this very challenging time and pushing forward the digital health agenda in Europe. I completely agree with Diogo on the key drivers of digitalization, which include, among others, data sharing ecosystem, digital skills, robust infrastructure. And I really liked your graph that pictures the ecosystem of cross-border telehealth with cultural, technical, and organizational parts. I also welcome the vision of 200% citizens having access to medical records in 2030. I hope that it will be the true. And Andrea also demonstrated how important are the regions in the digital transformation and the bottom-up approach that are only possible in a favorable regulatory ecosystem. But evaluating on the issues mentioned, I would say that Europe is facing 2 or even 3 challenges when it comes to telehealth, digital health in general. The first one would be to build a secure and trusted infrastructure for data exchange, which is necessary not only to control the epidemiological situation like in the COVID-19 pandemic, but also so that every citizen can get fast and effective treatment when traveling within the EU. And of course, it won't happen overnight. Different countries have different health systems. In many of them, there is missing connection between the private and public sector, and there are different reimbursement models. Nevertheless, the pandemic showed that cross-European cooperation in health is possible, as Paul has highlighted at the beginning in the opening presentation. And among examples are the COVID-19 tracking apps or vaccine certificates. But I expect that health will stay on the top of the European Commission agenda, and this should be a driver of post-COVID reforms. But we've also seen that national differences when the coverage of COVID tracking apps was quite high in countries like Sweden, Iceland, also Germany, but it was extremely low in Poland or Hungary, also Italy. And we see that technology is basically the same, but we can recognize some key issues like, for example, trust in government, trust in public organizations, leadership in healthcare, and many, many more. And these are very small details that are deciding when it comes to digitalization of different health systems and digitalization of European health system. The second challenge is the data processing for the secondary use, such as scientific research, development of new medicines. And this is currently being developed under so-called European Health Data Space. The technical infrastructure is the smallest challenge and we will be facing. So this might be built very quickly and is a matter of investments. But the entire sphere of new data economy in healthcare is something completely new, and we need to find kind of consensus between privacy and access to data, a point in the middle of the road where citizens have control over their data and are making best of the data for the good of all citizens, of all societies. So how the individuals perceive this issue of health data processing depends also on different factors, like even political preferences. It's hard to influence, and it will require a huge investment, first of all, in health and digital literacy. And here the relationship is simple. The more data, of course, good quality data, the greater is the effectiveness of artificial intelligence algorithms. So are we as a society, European society, ready for such a new model of healthcare? Are we willing to give up some privacy in exchange for better health? How to create this new data economy based on fair principles, transparency, and trust? So this is a huge elephant in the common room of European Union. And the time is ticking. The power of future economies will be based on data. Yeah? So China, the USA are the leaders in this race, and Europe. In Europe, it's kind of complicated. If you want to catch up, if we want to catch up in Europe, the data colonialism is something we have to be ready for. So that's the danger, and that's the vision that we have to include in our thinking. And the third and the last one issue and challenge that Diogo already has mentioned is the active role of the citizens. Yeah? We have to go back to the roots, which is digital and health literacy. Without skills, from my point of view, awareness, without awareness, the transformation in healthcare focused only on technological development, on systems, on apps, on gadgets and wearables won't simply work. So what I would suggest, let's start seeing digital skills, both of citizens and healthcare professionals, as the essential investment in the robust health system in Europe. And let's set up clear rules for fair data economy, and let's make some digital solutions so easy as, for example, iPhone is. Yeah? And let's change these European ambitions, and we have great ambitions, we have great visions, into concrete actions. That would be my postulate. And to sum up my short perspective, I skipped the GDPR because from my point of view, it's something that is working very well. And what we have to do is to move forward. That's it. Thank you very much.
Thank you so much, Arthur. You brought definitely a very interesting perspective, and also from the citizens' point of view, it's so important. And Ricardo, last but not least, the floor is yours. Yes.
Thank you, Paul. Well, I'm trying to. I'll try to bring some more, I would say, technical aspects. First of all, I'd like to stress that although some people don't feel like this, I really think that interoperability is much more complex than what normally people make of it. We have many different institutions currently involved in exchanging health data, and the expectations from the citizens and from the institutions is that this number grows. And for this, all these institutions, public, private, primary care, hospitals, pharmacies, whatever, we need to agree with ways to exchange data. And this is much harder than it seems. And I think that some of the issues, some of the problems that we normally mixed everything, we have some projects where you have stuff like automatic data collection, and analysis where this is simple, and other projects that for non-experts might seem the same, but that deal with human collected data in several different systems that need to exchange data. These types of problems are much harder. It's completely different for us to have some information collected automatically by a smartphone and send to a central database, or having 10,000 doctors or nurses collecting information in a form and then using that information to do whatever. Once you had the human factor in collecting data, it's a completely different difficulty of the project. Another thing that I would like to stress is that, and I'm a computer scientist by my course is computer science, and I've been working in health informatics for 20 years. And I must say that the knowledge that many of the developers that are involved in this area is not enough. A lot of people that are doing actually software that has an impact on our life do not know what is the state of art in many different areas. We have a lot of people that come to do software in health informatics that maybe a year ago would be on banking or some other area, and it's a different thing. The complexity is different. It's much more critical, and I think that a lot of the problems that we see today is due to this. And so we really need to think. Well, let me make it's similar to the doctors. For sure, you are not you would not like to have a brain surgery done by a doctor of the eyes or some other specialty. Well, in computers we have a lot of this. A lot of people that are not experts on, for instance, patients' records that are doing patient records. And then when you are hit with some type of emergency like COVID, all of these problems that are seen in the databases, in the software, they all rise up, and you see a lot of difficulties in doing stuff because they were not well prepared, were not well thought of. I'm going just to give you a couple of examples. In the beginning of COVID, me and 3 other colleagues, we started trying to follow the number of deaths by COVID in different countries in Europe, and it was impossible. The definitions used by death by COVID were different. The data sources that were actually being fed with this data were different. Then we changed into, okay, I'm going to look at the total number of deaths and not just for by COVID. It was also impossible. Some of the official numbers in many different countries, they use different definitions of weeks. What is a week? We found weeks with 9 days. And so this is very strange. Of course, once you start reading, why do they do that, you understand, but the definitions are different from one place to the other. And once you try to do interoperability, this is a big issue. We also tried to do some work on doing machine learning on data collected in Portugal related with COVID data. It's impossible also, or at least it's risky because some of the data were collected initially using one type of forms, then afterwards another type of forms was used, and this means that the variables do not mean the same things. And so it's a risk if you are doing machine learning on this. Of course, this is understandable, but we need to understand that it's different from you to have data or good data to do machine learning or analysis. It's completely different. some of this data is good enough for humans to read it, but it's not good enough for machines to read it, because machines, as you know, have a lot of difficulties in reading between the lines. Humans normally can understand that. And so I will really like to stress this. We have many different ways to understand interoperability. Currently, everybody wants to do interoperability projects, joining information from hospital, primary care, for pharmacies, home care, citizen data, fitness, social data, a lot of opportunities. And remember, a lot of poor quality data. We really need to stress this. Be very careful with this. Another thing is that we need a new group of medical informatics specialists that really know the state of art and that work on the institutions and can make the maturity level of all these institutions that do software grow. And this, I don't see it, at least in Portugal, I don't see it. And I'm involved in many different projects with other countries. We have some different initiatives, but not anything on a European level, okay? Finally, when we talk about what do data mean, we need also to stress that we need to teach terminologies in medical and nursing schools. If you want to analyze data collected by humans, you need the humans to collect it in a consistent way. And it's very hard for us to do that and to teach this to people that are working now. So we need to start, in my opinion, in the medical schools and the nursing schools, we need to have a language that is used by more or less everybody the same way. Of course, this is impossible to have it 100%, but what we have today is, well, it's not enough for our expectations that we have regarding the analysis of this data. And finally, just to extra action points, we need also to work on workflows. There is an initiative called the Integrating the Healthcare Enterprise that has profiles, this is the IHE, and we need more profiles on how information should be exchanged between different institutions. There was already some work done regarding COVID. We need more work of this on this area so that everybody knows each place inside the interoperability area and knows what information needs to exchange. And finally, and this is more or less a comment based on my colleague Andrea, one of the, I would say, most difficult things, at least for me, is that we need a way to express in a very objective way who has rights to access data. And we need to translate laws, if you want, into computable things, which is very, very hard. But if we want to do this in an automatic way, we really need this. And so we need to take out the human factor on knowing enough to understand if somebody has right to access or not, if you want to really take this to everybody in Europe. So a lot of challenges. Normally, I say this is an area where if you want to work on interoperability, you have work for the next 50 or 60 years. So it's a good job opportunity.
Thank you so much, Ricardo. And now giving the floor to Diogo Martins, because he has to leave for a personal and unavoidable life matter. And Diogo, and thank you much, Ricardo, for your interesting perspective, because I think there's a warning sign there when what you said, and we need to further discuss this. Diogo, you please wrap up, and then I'll open the floor also to other members of Zoom that are here. I know George Matthews and Gerard Bourbon, perhaps they have also something to say later on in the Ideas Lab. Diogo, the floor is yours for conclusions, and then we'll wrap up for the Ideas Lab.
Okay. Thank you so much to the panelists and to the colleagues. I think I will try to summarize, let's say, what we have here today with some calls for actions in 3 main pillars, at least in my perspective, and the rest of the panelists can complement if you'd like. So it is about, let's say, I will say that it is a kind of a triangle with people, processes, and technology. And I think this is a kind of a triple constraint that we need, let's say, to get the balance in some cases, and the other don't, depends on the situation. So for example, when we think about the people, it is really to start meeting their expectations, but in other way around, to protect their rights, because sometimes they don't know the add value or the value that the health data have. And the second perspective, it is about how can we in this people perspective increment the digital health literacy of the patients, of the healthcare professionals, like for example, Andrea and Ricardo have said. So it is very important to understand what are the requirements, what are the set of skills that are needed, and really to start investing on that. And I think this is very important to do it in courses, in really to dedicate the communication processes. In terms of the process itself, I think like other colleagues have said, it is important to understand what is the business flow, what are the pathways that citizens and the people and the professionals will go with it. So it is very important to understand what are the demands, for example, on the policy side, and how can we ensure that the digital technologies and interoperability will be aligned on that. And of course, in terms of the technology, I could spend here quite long time, like Ricardo have said, to really talk about interoperability. And I think the core asset, I will try to summarize it in 2 clusters of information. One thing, it is really about, let's say, the training of resources. We need to understand that e-health, it is a new domain on the information systems and even on the health sector, but it is something that is very important for us to have technical resources, but not only IT personnel, to have, let's say, lawyers, to have journalists, to have medical doctors, nurses, to really the community to go ahead in this type of interception. And of course, on the technical side, I think it is very important to start understanding building systems that are future-proof, that have, let's say, infrastructures that can use, let's say, coded and structured data by some common standards that could be reused in some use cases and the other don't, or let's say that use common frameworks that are agreed and have built consensus for a while and for experts. So this is my kind of call for actions in 3 domains. Thank you so much for the possibility to participate in here. Wish you a great session, and I believe that the parallel sessions will be very fruit for that. Stay tuned until the end for the conclusions of that.
Thank you so much, Diogo, and all the best. And let's now stop the live transmission for a moment, and we will be back here live for the conclusions of our Ideas Lab session that is going